All right, y'all. So we've got Zach Thomas back again. We are going to talk to him about his past month of residency, do a little bit of reflection, and kind of see where he's at now and what he's looking forward to, what challenges or new experiences that he's had in November. And maybe we can talk about what he's got coming up. So without further ado, I'll let you take it away, Zach.
Yeah, thanks again for having me, Rip. Really enjoy this kind of coming on, and it helps me also just reflect on kind of the past month and how things have been going as well. And happy to share it with everyone as well. So I know in the last episode, I kind of talked about a couple lectures that we had coming up. The one was exercise physiology, which was super interesting, and just not just the ins and out of physiology, but it was also just like how we can apply those principles to our patients, which was super interesting. Just yesterday, I had one on SIJ pain, which is not something that I'm very versed in, but it was super interesting, and it gave a lot more of a different take on how to look at it. Is what we were used to doing, or what I was used to doing from school, is more of pain provocation testing, and if clustering those kind of tests together. If someone's coming in with like low back SI pain, but it's not fitting in low back, then looking at pain provocation testing. But it was more of like a functional way to look at it, with different exposed to different tests that I've never heard of before, kind of thing. So that was really interesting, and found out that we all have a little bit of well, not we all, but the resident and I and the presenter, we all found some minor SI things that were going on each of us. So that was kind of cool. And yeah, so and then I guess clinic wise too, that's continuing to pick up as well. I would say I'm getting a little bit more efficient with documentation, which has been helpful, and time saving wise. The daily notes are much quicker. The evals still take a little bit longer, but other than that, I would say it's gotten a little bit more efficient overall. And the case load is picking up pretty significant. However, COVID wise kind of thing, it's almost getting not reversing, but that's kind of ramping back up again. So I'm kind of interested. I guess that would be more so of what's to come. But they're kind of encouraging us, to the patients that we can see telehealth, that have that conversation with them. And I did my first couple evals over telehealth, which was very interesting, and trying to figure out how efficient you could be without using your hands or without seeing the patient, and be as tech savvy as possible to try and get the camera in different positions to try and see what you want to see. And what I found is that it was still pretty effective. Like, as long as you could kind of get them positioned in different areas, you could still get a lot of things through observation. The hands-on is definitely nice, but it was kind of cool to see that you can get a lot. Just the power of observation, I guess, was very noticeable in those cases. And I guess as far as moving forward, it's just going to be interesting to see with COVID if it's going to go more so to telehealth stuff again. But I know right now they're trying to avoid that as much as possible, and want to stay open. But obviously safety is number one priority. And I have had some patients decide that like they want to switch over to telehealth or just cancel their remaining appointments because of all that. So I think that'll be something interesting in the next coming weeks, months, to kind of see how that all shakes out.
Right. How's your energy level? How's your stress levels? How's your schedule? Is it about the same as it was last time? I know last time you were getting a little stressed and your schedule was getting pretty busy. How's that changed over the course of November?
Yeah, I would say that schedule wise, I would say it's gotten, like, if I separate clinic wise, that's stayed relatively similar because my caseload is pretty full day to day already.
Mm-hmm.
So I can't really get any more full in that regard. but there's been more outside stuff this past couple weeks and the upcoming weeks. So that's added to it a little bit more. I have my first case presentation next Wednesday on a 18-year-old college pitcher with shoulder pain. So I'm super excited about it. It's just something that's taken a lot of time from other things.
Yeah.
And it's kind of, I was just reflecting last night that it's really my first presentation in front of a bunch of senior therapists that have been doing this like forever kind of thing.
Right.
Like up to this point, it's just been either to classmates, or the one time I went back to our high school there and did a lecture in the anatomy class. It's like those were all audiences that didn't really know the difference of what I was saying too much, if I put it that way, versus here it's going to be more of a they can challenge anything that I say kind of thing.
Yeah. Yeah.
So just being over prepared for it. So definitely a little stressful, but I feel like I'm confident enough in the material and looking at it as a growing experience and welcoming. I've already talked to them, like they're already saying they're going to drill me with questions. I'm like, just give it to me, just put it out there.
Yeah.
We'll see what happens. So, and then the following week after that, we have our first like written multiple choice exam as well on all of the lectures we've had thus far. So, and to be honest, I haven't even had the time to get to studying for that. So that is it's a little stressful in the sense that basically all of the lectures are like over 150 slides.
Yeah.
And like dense, and we're about a week and a half out. So
Yeah.
boiling up a little bit there.
I hear you on that. So we had the lecture we had to present. So like obviously leading up to that, it was like super busy, just planning an entire lecture and lab and material to, this is the only material these students are going to get on the diseases that we were presenting on, and combined with clinic, that got super busy. But then after that, everything kind of started to taper off, and now the university stuff's starting to taper off. But we also have our exam coming up in, I think it's in 2 weeks, on 13 2-hour lectures from some of the best neurotherapists in the country. So definitely have to start studying for that and prepping for that quite a bit. But that's okay. It'll all work out.
It'll all work out. And I know that they said for us, which is definitely going to make it harder, but also like when the time comes, it's going to be super beneficial, I think. And we're going to look back on it and be like, wow, that was really awesome. Is that all of our written exams are basically written like the OCS exam. So it's going to be very thorough, like every question or every answer is a right answer, but which one is the most correct. And
right.
So I think it'll make the exams harder, but it'll prepare better for the day when it's time to take that test.
Yeah. Is there anything else you want to share about November or that you have coming up? Any cool experiences, tough times, anything like that?
Another thing that, again, it's kind of up in the air, that we were supposed to start a couple weeks ago, but the whole COVID thing backed it up. But we're looking to hopefully get into the anatomy lab here in the upcoming weeks. So basically the medical students at Stanford and kind of assisting in their medical lab, they kind of break it up into different phases based on the body parts, and different professors teach different phases. So it's kind of right now on a professor by professor basis of who's okay with a couple extra people in the lab kind of thing.
Right.
So that was supposed to start a couple weeks ago, and we've been talking with the anatomy lab director, and she's hopeful that we'll be able to get in still. So that's something that hopefully in the upcoming weeks that we'll get the opportunity to, and something that I have a lot of experience with but enjoy doing is kind of working in the anatomy lab. So that's something I'm definitely looking forward to.
Yeah, that'd be awesome. Keep building on what you did in the lab at IC, and keep building off of that into I'm sure a much larger lab at Stanford. But all right. Yeah, I know personally, like it's just kind of like we're in the groove where it's just like always busy, but it's like trying to just make sure you take those times to chill out for a few minutes to make sure that you stay sane and don't get burnt out. But once you get in the groove, it kind of just, next thing you know, you turn around and it's already almost Christmas and you're like, what the heck? I just started.
Yeah, it's the time frame of just like, I can't even believe that it's December 5th already, kind of thing.
Yeah.
I mean, we've been here for going on like 3 months already, and it just doesn't seem like it's been that long. But I agree. I think it's just because we're just so dang busy, always doing something. So it's just like each day you just wake up and you have a full day that it just goes by so fast.
Yep.
There's never any time to just sit there and do nothing.
Yep. And if it is,
But,
it's like, I'm just going to sit here and take a nap because I'm exhausted.
but like you said, I think it's very important mentally to make sure that we put time aside for ourselves too, and try and step away from it for a little bit. Which I know I've been trying to do that. What exercise in specific, and then also out here, it's still warm enough ish during the day that I can go to the driving range, hit some golf balls. So that's still been on my list to do. I haven't gotten to that in a little bit, but I think it's important to keep all that in mind as well too.
Yeah. I finally like have a lifting partner that I kind of like, him and I go and are consistently and, holding each other accountable, which is good because I got to start putting some meat back on these bones. But
That's awesome.
so yeah, I'm sore as heck today. I've been eating bananas like crazy. So, all right. Well, if there's nothing else that you want to share from November or anything, thanks for coming on, and we'll chat with you again. I guess it'll be probably 2021 the next time we chat. Hopefully we can start to turn the page on 2020 a little bit and get over this whole COVID thing and start to get to experience where our new residencies are and where we're living in a typical year and setting. So
sounds good to me.
all right. We'll talk to you soon, Zach.
All right. See ya.
Bye.